Hi, my name is Candice, and today I will be performing a neurological assessment on my patient Sean. And because he is a minor, I do give permission for him to be in the video. So first what I'm going to do is I'm going to perform hand hygiene, and I'm going to knock on the door, introduce myself to the patient. I'm going to provide for privacy, and I'm going to check the lighting to make sure that the lighting is good. And then I am going to ask the patient some questions. So Sean, can you tell me your first and last name?
Sean Tate Diocese.
And can you tell me your date of birth?
2011, March 18th.
Okay, and do you know where you are?
I'm at my house.
Can you tell me what day it is?
March 21st.
Okay, perfect. So Sean is alert and oriented. His appearance is neat and tidy. His behavior is normal to his age, and his speech is appropriate to his age development. So Sean, do you feel dizzy?
No.
Do you have a headache?
No.
Do you have any weakness?
No.
Do you have any difficulty swallowing?
No.
Do you feel any tingles or numbness in your fingers or your toes?
No.
Okay, so now we're gonna go and we're gonna move on to assessing our cranial nerve, so which is 12. So the first cranial nerve is olfactory. Sean, if you can close your eyes for me. And I'm going to put like a smell under your nose. If you could tell me what you smell.
I smell the
Can you say it louder?
I smell deodorant.
Okay, perfect. So now I'm gonna move on. Oops, I'm gonna move on to cranial number 2, which is the optic. And I am gonna ask you, Sean, to hold this against your right eye, and I'm also gonna do that with my left eye. And I'm going to ask you to tell me how many fingers do you see?
1.
Don't move your head.
Okay. 2, 3, 4.
Okay, perfect. Thank you. And now we're going to move on to cranial nerve number 3. So I'm going to do 3, 4, and 6 together. So 3 is ocular motor, 4 is trochlear, and the 6 is abducens. So I'm going to have you cover your eye again. Can you cover your right eye? And I just want you to follow my finger. Don't move your head. And then change to the other eye. Okay, perfect. So there's no eye deviation. His eyes are symmetrical and there's no drooping of the eyelids. So now I'm going to move on to cranial nerve number 5, and that is the trigeminal nerve. So Sean, is it okay for me to put my hand on your face?
Yeah.
And I just need you to open your mouth, open and close. Do you feel any popping or hear any clicking when you open and closed your mouth?
No.
Okay, perfect. So there was no jaw deviation. So now I'm going to move on to cranial nerve number 7, and that is the facial. So Sean, if you can do this, blow your cheek, smile, close your eyes, and wrinkle your forehead. Okay, perfect. You can stop. So there is his face is symmetrical. And now I'm going to move on to cranial nerve number 8, and that is acoustic. So Sean, I'm going to whisper something, and you're going to repeat it to me.
1, 2, 3. 1, 2, 3.
Okay, perfect. So now we're going to move on to cranial nerve number 9. So I'm going to do 9, 10, and 12 together. So that would be the vagus, the hypoglossal, and what I'm gonna ask you to do, Sean, is to say ah. Okay, I'm just gonna. Okay. And then so his there's no deviation in the uvula, and his voice tone is normal. And if you can just open your mouth and move your tongue from side to side. Okay, perfect. Um, so now we're going to move on to cranial nerve number 11, which is the spinal. So I'm going to place my hand on your neck, if that's okay, Sean. And if you could turn your head towards, yeah, okay. Okay. So there's no neck deviation. So now I completed all of my cranial nerve assessment. I'm gonna move on to my motor assessment. So the first one I will do is like my strength and the tone. So if you can just look at your wrist, okay, and if I can grab your hand, and if you can kind of pull up your hand. Just want to see the strength, okay. So his strength is appropriate to his age development, and he's able to move his wrist freely. And let's see. Okay, so now we're gonna move on to the cerebellar, so which is the balance test. So Sean, now I need you to stand up for me. All right, and I need you to put your foot like this. Okay, for 3 seconds, and then close your eyes. Okay, you can put your foot down. So his balance, he has good balance for his age development. I need you to close your eyes and put your hand to the side for 3 seconds. Okay, and again, his balance is normal and appropriate for his age development. So now we're gonna do tandem walking. So Sean, I just want to show you. You're gonna do from heel to toe, in a straight line. Okay. So, ready? Go. Okay. Turn back around. All right. Perfect. So now we're gonna do the Romberg test. So I need you to hold your hand out like this and close your eyes for 3 seconds. Okay, you're done. So his balance is appropriate again to his age. And now we are going to move on to the coordination. So I'm gonna just ask you, you can sit. So we're going to, if you can put your finger to your thumb, just go like that. So on each, so all your fingers. Okay. And now we're gonna do, if you can put your finger to my finger, so one finger. Okay. Okay, perfect. And now you're going to hold your hand out like this, and then to your nose, your finger to your nose. Okay. All right, perfect. And last but not least, we are going to do the heel to shin test. So I need you to lie down. So lie down. Lie down. Can you come up? Okay, and I need you to bend your knee, like bend your foot like this, like against here. Okay, and then slowly push it down, like release it. Yeah, and then make it go straight. Okay, perfect. So I completed my neurological assessment. Thank you.